Welcome to the deep dive. Today we're focusing on something incredibly important for individuals living with spinal cord injuries, pressure injuries.
hmm
These are injuries that, well, while they're often preventable, they can have just a profound and negative impact on nearly every facet of life.
Absolutely. And what's striking is really the scale of this issue. We've delved into chapters from Wound Care Essentials, Practice Principles, which is a really comprehensive text. It pulls together a vast body of knowledge.
Right.
And also Susan L. Garber's chapter, specifically on the spinal cord injury population.
Right.
So our goal today is really to extract those crucial insights from these sources, providing you with a clear, concise understanding of pressure injuries, specifically in the context of SCI.
Okay, so let's start with understanding just how many people we're talking about. The numbers are really significant, aren't they?
They are indeed. In the U.S. alone, it's approximately 282,000 individuals living with a spinal cord injury. And a notable 17% of those are veterans. Every year, we see around 17,000 new cases.
Okay.
And interestingly, SCI is most frequent in males, typically between ages 16 and 30. They make up over 80% of the total SCI population.
Hmm.
Though the average age at the time of injury, that's shifted a bit. It's now around 42.
Okay. And when we consider how these injuries actually happen, it's quite a range of different events.
Exactly. Motor vehicle crashes, they're the leading cause, about 38% of cases,
Right.
followed by falls, that's around 30.5%. Acts of violence contribute about 13.5%, sports injuries 9%, and then medical or surgical procedures make up the remaining 5%.
Okay.
But, beyond the initial injury itself, individuals with SCI are also at risk for a number of secondary medical complications.
Things like lung issues, infections. It sounds like a lot to manage.
It is a significant list. You got osteoporosis, fractures, a condition called autonomic dysreflexia that involves sudden spikes in blood pressure,
Oh.
and heterotopic ossification, which is bone forming in soft tissues.
Mm.
And crucially for our discussion today, pressure injuries. They are a very common long-term complication.
Yeah.
And these are far more than just, skin issues. They carry substantial costs.
Financially.
Financially, yes, but also huge impacts on physical health,
Hmm.
social participation, financial stability, body image, independence, and just that overall sense of control.
So within the SCI community specifically, how common are these pressure injuries then?
Well, the rates vary a bit, but studies show that somewhere between 17% and 33% of individuals with SCI living out in the community will experience a pressure injury.
Okay.
And what's particularly important to note is that the longer someone has lived with an SCI, the higher their risk seems to become.
Ah.
The prevalence goes from around, say, 15% 1 year after the injury up to nearly 30% after 20 years.
Wow, 20 years.
Yeah, and the sources also point out that the risk of developing these injuries increases as individuals with SCI age.
That really underscores the sort of long-term nature of this challenge. Now, to get a clearer picture of the scope of the problem, where can we find the most reliable information on this?
The Spinal Cord Injury Model Systems database is an incredibly valuable resource for that.
Okay.
Because it tracks individuals admitted to specialized centers really quickly, like within 24 hours of their injury, it gives us some of the most reliable data available. They've been collecting info on pressure injuries since 1981,
Right.
and the trends it reveals are quite clear.
And what do those trends tell us about how big this problem really is?
Well, we see a definite increase in pressure injuries in people who've been living with SCI for a longer time,
Mm-hmm.
especially those more than 10 years post-injury.
Mm-hmm.
Among veterans with SCI, over a third reported having pressure injuries just in the past year alone.
A third? Wow.
Yeah. And perhaps most significantly, pressure injuries are the second leading cause of rehospitalization for individuals with SCI in that U.S. Model Systems database.
Second leading cause.
Yeah, they account for 17% of rehospitalizations within the first year after injury. And this climbs to a staggering 38% at 20 years post-injury.
It's a huge impact on healthcare resources and, more importantly, on people's actual lives. The sources also mention specific research findings, right?
Yes, they do. One study found that over 37% of individuals with SCI developed a pressure injury during their initial acute care and inpatient rehab.
So right at the beginning.
Right at the beginning.
Here.
And the risk was significantly higher for those who also had pneumonia or needed mechanical ventilation to breathe. And had more severe injuries, what's classified as ASIA A, meaning a complete spinal cord injury.
Okay.
And the model systems data further backs this up, showing that 34% of patients admitted very shortly after their SCI developed at least one pressure injury during that initial period.
Mm-hmm.
And as we've discussed, this number just increases over time. It's also notable that individuals with paraplegia, so injuries between the T1 and S5 vertebrae, are more likely to be readmitted to the hospital specifically because of pressure injuries.
And are there specific risk factors for that readmission?
Yeah. Key factors that increase that risk include having a complete injury, tetraplegia, which is injury affecting all four limbs, older age, the presence of other health conditions, and interestingly, if the initial SCI was caused by violence.
So even after an injury heals, it sounds like it's not necessarily the end of the story. What are the chances of these injuries coming back recurring?
Unfortunately, the recurrence rates are quite high. Different studies report figures ranging anywhere from 21% up to 79%.
That's a huge range.
It is. And epidemiological research indicates that between 36% and 50%, so up to half of individuals with SCI who initially develop a pressure injury, will experience it again.
Within the first year.
Within just the first year after it heals, yeah. One study even found a 35% recurrence rate, regardless of whether the initial treatment was medical or surgical.
Wow.
Given these numbers, it really highlights the persistent nature of this challenge.
That's really disheartening. And it seems like even surgery doesn't guarantee they won't come back either.
That's correct. Another study reported a 55% recurrence rate within 2 years following surgical repair.
55%.
Mm-hmm. And a long-term study that followed patients for 20 years showed that 31% of recurrences happened right at the same site as the original injury.
Okay.
And another 21% occurred at a completely different location.
Hmm.
Now, while some research suggests that maybe lifestyle factors like regular exercise, a balanced diet, might offer some protection against recurrence,
Right.
there are unfortunately several other factors that can increase that risk.
What are some of those factors that make recurrence more likely?
Several factors have been linked to a higher risk. These include being male, older age, identifying as African American, being unemployed, residing in a nursing home, and having undergone previous surgery for a pressure injury.
Okay.
Additionally, factors like substance abuse, a lack of adequate social support, and maybe not having received sufficient education on how to prevent these injuries. Those play a significant role too. In specific research focusing on veterans, also identified being Black, having multiple pre-existing health conditions, scoring higher on a specific pressure ulcer risk assessment scale, and actually spending more time sitting down when discharged from the hospital as significant predictors of recurrence.
It's clear that these injuries have just a massive impact on people's well-being, and it sounds like they also create a really significant financial burden, both on the healthcare system and on individuals themselves.
The financial burden is indeed immense. Estimates from 2008 to 2012 suggested that the medical management of pressure injuries cost the U.S. healthcare system somewhere between $9.1 and $11.6 billion every year.
Billion with a B.
Billion, yeah. And to put that into perspective, the average total hospital cost for individuals who develop pressure injuries was significantly higher compared to those who didn't.
Makes sense.
And it's well established that just developing pressure injuries increases both the overall cost of hospitalization and how long a patient needs to stay in the hospital.
And it's not just the initial injury treatment. I imagine the ongoing care must also be incredibly costly.
Absolutely. A large portion of these reported costs is directly related to the treatments required, with wound dressings being a particularly significant expense.
Right.
Studies looking at veterans with SCI have shown high costs per outpatient visit for pressure injury treatment, along with frequent hospital admissions. Stage 4 pressure injuries, those are the most severe.
Yeah.
And pressure ulcers located on the pelvis tend to be especially prevalent and costly to manage.
Okay.
Research on SCI populations more broadly reveals high average monthly costs for treating chronic pressure injuries out in the community. And hospital admissions consistently represent the largest single cost component.
Right.
The annual costs for both inpatient and outpatient care are significantly higher for SCI veterans who have pressure injuries compared to those who don't. One estimate suggested an additional cost of over $73,000 per year just for treating SCI veterans with pressure ulcers.
$73,000 extra per year? Wow. Given how common they are, how often they come back, and that huge financial impact, really understanding the risk factors seems absolutely crucial for prevention efforts.
It is paramount.
Yeah.
The medical literature has identified over 200 reported risk factors associated with developing pressure injuries.
200.
Over 200. Interestingly, many of these were initially identified through studies focusing on elderly individuals in nursing homes.
Oh, okay.
And some of those factors might not be as directly applicable to individuals with SCI. For instance, while immobility is certainly a risk factor in both populations,
Sure.
a key difference is that individuals with SCI are typically expected to take a very active role in their own prevention strategies.
Right. So are there specific risk factors that are, let's say, more relevant to the SCI population than perhaps to other groups?
Yes, definitely.
Whoa.
While some general risk factors like limited mobility are relevant across the board, Byrne and Salzberg summarize the major risk factors that are particularly significant for individuals with SCI.
Okay. What are those?
These include the severity of the spinal cord injury itself.
Yeah.
So thinking about the degree of immobility it causes, whether the injury is complete or incomplete, the presence of incontinence, any diminished sensation, and the presence of spasticity, that's involuntary muscle stiffness or spasms.
Okay.
Pre-existing health conditions also play a big role. Things like advanced age, a history of smoking, lung and heart disease, diabetes, kidney disease, and any impairment in cognitive function significantly increase the risk.
Mm-hmm.
Living in a nursing home environment, as well as experiencing malnutrition and anemia, are also identified as major contributing factors.
And on the flip side, are there any factors that might actually be associated with better outcomes or maybe a lower risk of developing these injuries?
Indeed, there are. Maintaining a healthy body weight seems to help. Being able to return to work or fulfill family responsibilities and avoiding smoking or any form of tobacco use are associated with better outcomes. Additionally, a history free of suicidal thoughts or attempts, incarceration or substance abuse seems to have a protective effect. The Consortium for Spinal Cord Medicine Clinical Practice Guidelines, they offer a really comprehensive way of categorizing all these various risk factors.
What kind of categories do they use? How do they group these risks?
They break them down into several key areas.
Okay.
First, there are demographic factors,
Mm-hmm.
age, gender, ethnicity, marital status, level of education.
Okay.
Then they look at physical, medical, and factors directly related to the SCI itself, like the level and completeness of the injury, activity and mobility levels, nutrition, bladder and bowel control, issues with moisture on the skin, and other health conditions like diabetes or spasticity.
Right.
They also highlight the importance of psychological and social factors, things like psychological distress, financial problems, cognitive abilities, substance abuse, how well the individual sticks to prevention strategies, and even their personal health beliefs and practices.
Mm.
And finally, the type and condition of the support services they use both in bed and in their wheelchair are considered critical risk factors.
It really sounds like psychological and social well-being play a much more significant role than perhaps just the purely physical aspects of the injury.
Absolutely.
Yeah.
Early research in this area identified psychological factors like maybe an unwillingness to take responsibility for skincare, low self-esteem, a general dissatisfaction with life. These could contribute.
Right.
Poor social adjustment has also been consistently linked to increased risk. More recent guidelines emphasize factors like depression, anxiety, having a negative self-image, maybe poorly managed anger or frustration,
Yeah.
because these can all interfere with a person's ability to cooperate with care plans and can lead to increased inactivity or self-neglect.
Makes sense.
Cognitive impairments, maybe from a traumatic brain injury or substance use, are also significant risk factors. Furthermore, social, environmental, and contextual factors like homelessness, involvement in gang activity, financial instability, lack of social support, these can create major disruptions and significantly increase risk.
Wow.
So it's crucial to assess not just the physical condition, but also an individual's motivation to prevent ulcers and to really understand their unique life context, their daily routines, the activities central to their life. That's key for effective prevention and treatment.
Yeah.
And, as we mentioned earlier, just using inappropriate or worn-out support surfaces can dramatically increase the risk too.
So knowing all these different risk factors, what's the overall approach to preventing these injuries from occurring in the first place?
Well, given that individuals with SCI face a lifelong risk, starting immediately after the injury occurs, the early implementation of pressure reduction strategies is absolutely critical.
Right from the start.
Right from the start. Comprehensive preventive plans should be developed for each patient, and these plans need to involve both the individual themselves and their families or caregivers.
Okay.
Now, while providing printed and visual educational materials is common practice,
Yeah.
there's actually limited data on how well patients retain this information and consistently follow those prevention strategies once they're discharged and back in their daily lives.
Ah, so the follow-through is the challenge.
That gap between knowledge and action is a key challenge. Precisely.
It seems like turning that knowledge into consistent everyday habits is the real hurdle.
Exactly. Historically, some specialized SEI centers have established very thorough prevention education programs. More recent research has identified factors that seem to protect particularly underserved adults with SCI from developing these injuries.
Oh, what are those protective factors?
Things like being actively involved in meaningful activities, having a strong personal motivation to prevent negative health outcomes, having stable resources and access to necessary equipment, possessing good communication and self-advocacy skills, certain positive personal traits, maintaining good physical health where possible, and engaging in proactive self-care behaviors.
Okay.
When it comes to education itself, key needs have been identified and ranked. Things like having a clear understanding of the lifelong risk involved, knowing how to effectively manage their own skincare and work in partnership with healthcare providers, consistently performing prevention strategies that are compatible with their individual level of function, and being able to effectively coordinate their social support networks.
Right.
Ultimately, preventing pressure injuries is deeply intertwined with a person's unique daily life and their overall lifestyle. Qualitative research highlighted 8 interconnected lifestyle principles related to why pressure injuries develop.
8 principles, like what?
Yeah, things like a constant underlying awareness of danger, the impact of changes or disruptions in daily routines, the consistent performance of preventive behaviors, the sort of risk ratio of liabilities versus buffers, the need for individualized approaches, the individual's own motivation and awareness, the lifestyle trade-offs people inevitably make, and their access to necessary care, services, and supports.
Okay, so for someone who is returning home after a spinal cord injury, what are the absolute key things they need to focus on in their daily routine to prevent these pressure injuries?
Yeah, that period immediately after returning home is indeed a time of high risk. Key strategies that really must become part of their daily life include performing a thorough visual and tactile inspection of their skin at least twice a day.
Visual and touch. Okay.
Both. Maintaining good personal hygiene is also absolutely crucial. They need to make sure they're turning and repositioning their bodies frequently throughout the day and performing regular weight shifts, especially when sitting in their wheelchair.
Right, the weight shifts.
It's essential. Using appropriate and well-maintained support surfaces for both their bed and their wheelchair is critical. Adequate nutrition plays a vital role in skin health, as does maintaining a generally healthy lifestyle, so avoiding or minimizing alcohol, tobacco, and any illegal drug use.
And if, despite best efforts, a pressure injury does develop, how is it properly assessed? It sounds like it involves more than just looking at the surface of the skin.
Absolutely. A comprehensive skin assessment involves 2 key phases. The first is a broader evaluation of the individual as a whole, taking into account their social history, complete medical history, their level of functional independence, relevant lab tests, nutrition assessment, psychological health, behavior patterns, cognitive abilities, social and financial resources, personal care assistance available, the positioning aids and equipment they use, and their lifestyle habits, tobacco, alcohol, drugs.
So the whole picture first.
The whole picture. Then the second phase is a very detailed description of the pressure injury itself and the tissue surrounding it. This includes carefully documenting the suspected cause and how long it's been present, the precise anatomical location, the appearance of the wound bed, its exact size, length, width, depth, the stage or severity, any exudate or fluid draining, any odor, presence of necrotic or dead tissue, any undermining that's tissue damage extending under the wound edges, any sinus tracts or narrow channels, signs of infection, the types of tissue present, viable or non-viable, and the condition of the wound margins and the surrounding skin.
Wow, that's detailed.
It is. Taking photographs can also be very helpful for tracking changes over time. Regular monitoring, reviewing all these factors at each dressing change and at regular intervals is absolutely essential.
I can imagine that assessing skin on individuals with darkly pigmented skin might present some unique challenges compared to lighter skin.
It certainly does. While areas of potential damage might appear darker in color, relying solely on visual cues can often be insufficient.
So what's key then?
Tactile assessment. The sense of touch becomes even more critical. The affected skin might feel unusually taut and shiny, possibly indurated, which means hardened, and potentially warmer to the touch compared to the surrounding skin.
Okay.
Color changes might range from a purple to a bluish hue, And a key indicator in lighter skin, whether the skin blanches or turns pale when caressed, often doesn't occur in darkly pigmented skin that has pressure damage.
Right.
So for this population, a thorough assessment really relies heavily on carefully feeling the skin in addition to a very detailed visual examination.
Okay, that's a really important distinction. Now, prevention and treatment are clearly interconnected. When treatment becomes necessary, what does that typically involve for pressure injuries?
Yes, they are absolutely linked. However, it's important to remember that individuals in the immediate period after a spinal cord injury are often dealing with just an overwhelming amount of new information.
Yeah.
And their capacity to absorb and retain details about preventing secondary complications like pressure injuries can be, well, limited. Plus, the trend towards shorter hospital stays also means there's less structured time available for that in-depth patient education during the initial hospitalization.
Right. So once a pressure injury has developed, what are the primary approaches to non-surgical treatment?
Non-surgical treatment is a complex and individualized process. It's tailored to the specific patient and the characteristics of their injury. It typically involves a series of key steps.
Okay.
First, meticulous cleansing of the wound is essential, often using solutions like normal saline, sterile water, pH-balanced cleansers, or even lukewarm tap water.
Right.
Debridement, that's the removal of any devitalized or dead tissue from the wound bed, is a crucial step to promote healing.
Okay, get rid of the bad tissue.
Exactly. Following cleansing and debridement, an appropriate wound dressing is selected and applied. The overall treatment plan should also consider the potential use of newer technologies aimed at enhancing wound healing.
Mm.
An ongoing tailored education for both the patient and any caregivers is absolutely essential to prevent the injury from recurring. Now, while complex behavioral and educational interventions on their own haven't always shown consistent effectiveness,
Right.
taking into account a person's pre-existing habits and incorporating strategies for positive habit change can significantly support prevention efforts.
Okay.
Initially, the primary goal is to create a physiologically favorable environment within the wound to encourage healing. Among the various adjunctive therapies that have been explored, electrical stimulation is one of the few that currently has sufficient scientific evidence to support its use in treating pressure injuries in individuals with SCI.
Electrical stimulation, interesting.
Yeah. If the pressure ulcer doesn't show any significant signs of healing within, say, 2 to 4 weeks, the entire treatment plan needs to be carefully reevaluated and modified.
And for pressure injuries that are more severe, stages 3 and 4, surgery is often a consideration, right?
Yes. Stage 3 and Stage 4 pressure injuries in patients with SCI are frequently managed with surgical intervention.
What are the main goals of doing surgery?
The primary goals include preventing the loss of vital protein through the open wound, significantly reducing the risk of serious complications like osteomyelitis, that's bone infection,
Right.
sepsis, which is a life-threatening response to infection, and renal failure. Also, reducing the overall length and cost of hospitalization, improving the patient's hygiene and physical appearance, and ultimately accelerating the healing process.
Okay. What does the surgery actually involve?
Well, the procedure typically involves carefully excising the entire pressure injury, along with any surrounding scar tissue, any underlying bursa, soft tissue calcifications, and any necrotic or infected bone that might be present.
So cleaning everything out.
Cleaning everything out. The resulting space is then filled with healthy tissue, often using muscle or fascia flaps, to improve the blood supply to the area and help redistribute pressure. The skin is then resurfaced with a large flap of healthy tissue, carefully positioning the new suture lines away from areas likely to experience direct pressure in the future. The surgical approach also aims to preserve options for future surgeries if they become necessary.
It sounds like a very complex procedure that requires a really coordinated effort from the medical team beforehand.
Absolutely. In the period leading up to surgery, close collaboration between the rehabilitation team and the surgical team is vital.
Why is that?
Well, it ensures that any infection is well controlled, the patient's nutritional status is optimized, their bowel function is regulated, any muscle spasms or contractures are managed, and any other underlying health conditions are addressed.
Okay.
Factors like a history of previous surgery in the area, smoking, a UTI, heterotopic ossification, they can all potentially influence the surgical outcomes.
Right.
And while new surgical techniques are continually being developed, long-term data on how well the skin grafts and flaps hold up and the rates of recurrence are still somewhat limited in the research. However, surgical success largely depends on a thorough debridement before surgery. The patient's ability and willingness to comply with post-op care, effective management of other health problems, adequate support after surgery, and crucially, consistent pressure relief in the operated area.
Support services like specialized mattresses and wheelchair cushions, we hear a lot about those.
Yeah.
What specific role do they play in managing pressure injuries?
Yeah, support surfaces are specifically designed to reduce the pressure that occurs between a patient's body and the surface of the bed or wheelchair.
Okay.
However, it's really important to understand they don't actually prevent or heal pressure injuries on their own.
Ah, okay. They're part of a bigger picture.
Exactly. They're a critical part of a comprehensive overall program for both prevention and management.
Hmm.
And they should be prescribed by a healthcare professional based on an individual's specific level of risk.
Right.
Pressure redistribution products. These include active and reactive mattresses, overlays, specialty hospital beds that are chosen based on the patient's risk factors and current condition.
What's the difference between reactive and active?
Generally, reactive surfaces are suitable for individuals with a stable spine who can reposition themselves. Active support surfaces are often used for patients with multiple existing injuries or those who've recently had flap or skin graft surgery.
Okay.
Proper positioning techniques and devices in bed are also essential, making sure there's no direct pressure on any existing injuries. Using pillows and cushions strategically helps achieve this.
Mm-hmm.
Individualized turning schedules, where caregivers or the patient regularly change position, are also important. Specialty beds, like air fluidized and low air loss beds, are used based on patient needs and facility expertise.
And for wheelchairs?
For wheelchair users, there's a variety of cushion materials,
Mm-hmm.
foams, gels, air-filled, water-based options. These are designed to aid pressure redistribution, minimize shearing forces, provide comfort and stability, reduce heat and moisture buildup, and enhance functional abilities.
Right.
It's vital that wheelchairs and seating systems are highly individualized and regularly inspected for any wear and tear that could compromise effectiveness.
Good point.
And again, it's important to reiterate, wheelchair cushions are a tool to help manage pressure, not a standalone solution for prevention or healing.
Got it.
For individuals who can't independently relieve pressure while sitting, power weight shifting wheelchairs can be very beneficial.
Okay.
But even with appropriate cushions, individuals using a wheelchair full-time should aim to actively offload their weight for 1 to 2 minutes every 30 minutes.
Every half hour. Okay.
Yep. Interestingly, the potential for pressure issues on commode chairs during bowel care is an area that hasn't been studied extensively, though padded commode seats have shown some initial promise.
Needs more research there.
Definitely needs more research on optimal sitting time on commodes and the best approaches to bowel care for individuals at risk.
Besides the conventional treatments we've discussed, have there been any other, perhaps less traditional interventions that have been explored for pressure injuries?
Yes, there have been reports on various adjunctive therapies used alongside standard care with varying levels of success.
Like what kind of things?
Things like electrical stimulation, which we mentioned,
Yeah.
ultraviolet or UV, and laser therapy, hyperbaric oxygen therapy, ultrasound treatments, negative pressure wound therapy, sometimes called wound VACs,
Right.
certain non-antibiotic drugs, various topical agents, artificial skin substitutes, and growth factors.
Okay.
However, when we really look at the scientific evidence, only electrical stimulation currently has sufficient support to recommend its use in treating pressure injuries, specifically in individuals with spinal cord injuries.
So only E-stim has strong evidence for this group.
For this specific population, yes. The evidence for other adjunctive therapies is generally less robust.
Okay. Looking at the overall picture now, what would you say are the key takeaways from all this information we've covered, and where do you think future research efforts should perhaps be directed?
Well, research in the field of spinal cord injury has certainly advanced over the years, and we've seen progress in how pressure injuries are treated, new dressings, better wheelchair tech, improved pressure redistribution devices, evolving surgical techniques.
Right.
However, it's notable that research specifically focused on the prevention of pressure injuries in this population remains somewhat limited. And while randomized controlled trials are considered the gold standard for evaluating both prevention and treatment strategies, conducting these types of studies in real-world healthcare settings often presents significant logistical and practical challenges.
Yeah, I can imagine.
So, moving forward, future research really should prioritize prospective studies that specifically focus on preventing the recurrence of pressure injuries. This includes investigating the effectiveness of long-term self-management programs and strategies that can be realistically implemented in people's daily lives.
Makes sense. To really bring this discussion to life, let's consider a specific patient scenario. You mentioned Mr. K earlier. Tell us about him.
Right, Mr. K. He's a 48-year-old African-American man who sustained a complete T8 spinal cord injury from a car crash 7 years ago.
Okay, T8 paraplegia.
Paraplegia, yes.
Oh.
He lives independently, is currently unmarried and unemployed, and has a history of hypertension. Now, despite receiving education on pressure injury prevention during his initial rehab,
Yeah.
he developed a stage 3 pressure injury on his right ischium, that's a bone in the pelvis, within a year of being discharged, and he required surgery for it.
Oh, okay.
Unfortunately, less than a year after that first surgery, he developed a more severe stage 4 pressure injury, this time with an associated bone infection, osteomyelitis, on his left ischium,
Oh, no.
which led to another hospital readmission. Several factors in Mr. K's life seem to complicate his situation. He reports a lack of significant social or family support, he appears to be experiencing depression, and he struggles to take an active role in managing his overall health. He expresses a desire to work as a computer programmer, but hasn't actively been seeking employment. He's often inconsistent with taking his hypertension medication and has also recently developed type 2 diabetes.
Okay, so comorbidities, too.
Comorbidities, yes. He's a smoker and occasionally uses alcohol and illegal drugs. And, significantly, his routine for bowel care involves spending a prolonged amount of time sitting on the commode, which likely contributes to increased pressure on his vulnerable skin.
It sounds like Mr. K is facing a really complex set of challenges. What would be the initial priorities in addressing his current situation?
Well, the most immediate priority would be to treat the active infection and to surgically repair that stage 4 pressure injury, including addressing the osteomyelitis.
Right, deal with the acute problem first.
Exactly. During this current hospitalization, it's absolutely crucial to assign Mr. K a case manager who can coordinate his discharge planning and ongoing follow-up care. An occupational therapist, one with specialized knowledge in SCI and pressure injury management, should work closely with Mr. K to develop a highly personalized prevention plan, one that realistically fits into his daily lifestyle.
Tailored to him.
Very tailored.
Yeah.
This plan needs to specifically address strategies for regular weight shifts, thorough skin checks, emphasizing those challenges with darkly pigmented skin,
Yeah.
optimizing his nutrition, maintaining good hygiene, limiting prolonged sitting, improving adherence to medications, and reducing or eliminating his use of tobacco, alcohol, and illegal drugs.
Okay.
A comprehensive assessment of his current bed and wheelchair support surfaces is also essential. In Mr. K's case, these were found to be in poor condition.
Ah.
So, ordering a new, appropriately fitted wheelchair with a pressure-relieving cushion and providing a suitable mattress overlay for his bed would be necessary.
And teaching him how to use them properly.
Absolutely. He needs clear instruction on proper care and maintenance of this equipment and how to recognize signs of deterioration. Furthermore, programs to effectively manage his hypertension and newly diagnosed type 2 diabetes need to be initiated.
Right, the other health issues.
Exactly. His current bowel management regimen should be carefully reviewed and modified to minimize that prolonged sitting on the commode. And a more appropriate commode and shower chair should be ordered if needed.
Okay.
A home visit by the OT could help identify any necessary environmental adaptations to support his independence and safety. And given his apparent depression and lack of social support, a referral to a psychologist or counselor is also a critical component of his care.
Yeah, addressing the mental health aspect.
Vital. Finally, providing Mr. K with a comprehensive list of relevant resources, contact info for his case manager, equipment vendors, doctors, clinics, and information about potential employment opportunities will be vital for his ongoing management and successful reintegration into the community.
That really paints a clear picture of the comprehensive wraparound support that's needed in a case like this. Now, before we wrap up our deep dive, we have a quick quiz to test what you've learned. Ready?
Let's do it.
Question 1. Major risk factors for pressure injury development in the SCI population include all of the following except T. A, pre-existing conditions. B, severity of the SCI. C, gender. D, nutrition.
Okay, except T. I would say the answer there is C, gender. While gender might influence some aspects, like recurrence risk factors we discussed, it's not identified in the sources as a major primary risk factor for the initial development of pressure injuries in the SCI population, compared to the others listed.
Okay, got it. Question 2. The most commonly occurring complications of SCI are A, fracture. B, urinary tract infection. C, pressure ulcer development. D, pulmonary respiratory complications.
Most commonly occurring. According to the sources we looked at, D, pulmonary respiratory complications are certainly major, especially right after the injury.
Right, in the acute phase.
Exactly. But B, urinary tract infections, and C, pressure ulcer development, are also extremely prevalent long-term complications for individuals living with SCI. It's a bit tricky, but if we consider the whole lifespan post-injury, UTIs and pressure injuries are huge ongoing issues, whereas acute pulmonary issues might lessen for some over time. The sources highlight pressure injuries and UTIs as very common long-term problems. Let's lean towards B and C being highly prevalent long-term. Maybe pressure ulcers slightly edge out UTIs in some stats as a leading cause of rehospitalization, but both are very common. The sources specifically mention pressure injuries as the second leading cause of rehospitalization, so perhaps C is the intended answer in that context, acknowledging how significant they are long-term.
Okay, we'll go with pressure ulcers as highly significant long-term. And finally, question 3. A pressure injury prevention plan for a person with SCI should always include the following. A, every 2-hour turning and repositioning schedule. B, bowel management regimen with padded commode seat. C, offloading from the wheelchair every 30 minutes for at least 1 to 2 minutes. D, B, and C only.
It should always include, A, an every 2-hour schedule might not be necessary or feasible for everyone. It needs individualization. B, bowel management and padded seats are important considerations, but maybe not always mandated in every single plan. But C, consistently and frequently offloading pressure when seated in a wheelchair is pretty much a cornerstone of prevention for full-time wheelchair users according to the guidelines. So I'd say C is the most accurate answer for something that should always be included for those individuals.
Right, that consistent offloading. Okay, so to summarize our deep dive today, it's really clear that pressure injuries are a significant, multifaceted challenge for individuals living with spinal cord injuries.
Hmm.
But by gaining a deeper understanding of the various risk factors involved, emphasizing the absolutely critical role of consistent prevention strategies, and appreciating the complexities inherent in treatment, we can definitely work towards achieving better health outcomes for this community.
Absolutely.
You should now have a much more comprehensive overview of this vital topic.
And this leads us to a really important question for you, the listener, to consider. Given the intricate way that medical conditions, social circumstances, and individual lifestyle choices all interact, what do you believe are the most substantial barriers to achieving truly effective pressure injury prevention within the SCI community?
Yeah.
And maybe what innovative solutions might we be able to explore to overcome these significant challenges and ultimately improve the lives of those affected by spinal cord injuries?
Well, definitely a lot to consider there. Thank you for joining us for this deep dive. We encourage you to continue exploring this important topic and to engage in further discussion.